When someone makes a blood donation at Naval Medical Center Portsmouth, they are contributing to the blood supply of the Armed Services Blood Program.
From a whole blood unit, we'll make a unit of packed red cells, and then we'll also use that blood to make fresh frozen plasma and possibly another product known as cryoprecipitate. It's placed in our available inventory, and then when we get a request from one of the wards that they have a patient that needs a transfusion, then it's taken from the blood bank up to the ward and transfused to the patient by the nursing staff.
Adult patients who require transfusions receive care in the Ambulatory Infusion Center.
We have oncology patients that require blood transfusions because of their chemo treatment. We have some patients that have an autoimmune disease that could require blood transfusion. We do have some patients that, because of the medication that they're on, causes their hemoglobin to drop, thus requiring a blood transfusion.
Matching blood products is usually easy, but can be challenging for patients who have regular transfusions because of antibodies that develop as a result of the transfusions. One of the AIC's patients is retired Army First Sergeant Oliver Walmon, who was diagnosed with myelodysplastic syndrome. Oliver's bone marrow does not produce enough healthy cells. He has received transfusions every 2 weeks for the past year and a half.
I couldn't do without it, and I really appreciate anybody who's giving that blood, because I found out that I need it, and a lot of people do need it. I donated blood myself in the military religiously, and I used to think about the little kids that had leukemia and cancers and stuff, and that drove me to give that blood.
Dozens of NMCP's pediatric patients also require transfusions. Keshaun Spencer was diagnosed with sickle cell disease and has received monthly transfusions for nearly a decade.
You see the signs posted for donating blood all the time, and people probably, don't pay it a second mind, but there are people that really, their life depends on other people donating blood. So if it wasn't for the donors, what would we do? So they're very important.
I'm really grateful for that, because pretty much if it wasn't for them, I probably wouldn't be here today. And that's really a blessing.
Unfortunately, Cordrick said it's typical that not enough donors walk through the door each month. NMCP's goal is 60 platelet units and 500 whole blood units.
When we don't meet our collection goals, we reach out to other military facilities. If they have an excess of blood, they can send us products that we can use.
4 units must be purchased through civilian agencies. Platelet units are $600, while the cost for whole blood depends on the type. A positive is about $285, while O positive is about $400.
We're always in constant need of blood or blood products. So the more military members, the dependents and family members that can come in and donate, it'll greatly increase our in-house supply. And then we can also trickle that downrange and for the warfighting efforts. I think that if you think about the end result of saving someone's life, a simple prick of the needle should not deter you at all.